Professor Deirdre Heenan, Professor of Social Policy at the University of Ulster. I think any new minister taking up the health portfolio in Northern Ireland will have a number of key challenges. I think the biggest challenge for them will be how to ensure that people in Northern Ireland have access to high quality health and social care services based on need rather than ability to pay. We see increasingly in England increasing privatisation of health services, and I think here there's a strong belief that healthcare should not be based on ability to pay. I think it's difficult for the Minister because health, as we know, is an avaricious user of services. In other words, health need always seems to be increasing. We never seem to get to the point where we can say we've satisfied healthcare need. There are new diseases, new treatments, new issues in the field of healthcare daily. But I think the Health Minister has to prioritise. I think he should also look to, for example, Scotland and Wales and their devolved governments and look how they've focused on well-being. What we have seen is a major streamlining of the system. Is there room for further streamlining? I would say yes. Many healthcare professionals have also said yes. They would question the role of a commissioning authority within our local system and would question the need for it. We might also question the need for a patient-client council. They are supposedly the voice of the patient in Northern Ireland. But in the recent debates around hospital-acquired infection, car parking charges, it's very difficult to see where their voice has been heard and how effective they actually are. I think the big change and the big drive in England is towards privatisation, and that is always going to be an issue for people in Northern Ireland and the government of Northern Ireland. But we must remember in Northern Ireland, we alone in the UK have an integrated system of health and social care, and that comes with its own particular issues. So, for example, the Health Minister has argued that he wants ring fencing of the acute care sector budget. The difficulty with an integrated service is that social services are with your acute services, and in any kind of streamlining or any kind of prioritisation of budgets, the acute sector always wins out. The difficulty then in Northern Ireland is we have health and social care, particularly social care, so domiciliary services, residential homes, care in the community packages, always seem to be starved of funds, or they are the people who suffer the most. So I think in Northern Ireland there's a particular issue that we need to protect the social care budget. Particularly as we have an ageing population, we need to ensure that we have the services that allow people to live independently within the community. In the last 15 years, choice has become the buzzword in National Health Service, in health and social care, and the governments have promoted the importance of choice. You should have a choice of your providers, a choice of your hospital, a choice of your GP. I think if you ask people in Northern Ireland, they're less interested in choice, but more interested in an assurance that the services they get will be high quality, efficient and effective. I think the message for the Minister is to ensure, as I've said, equal access to services for people in Northern Ireland based on need, not based on their geographical location or their ability to pay.